Hi, my name is Tiffany Lennox, and I am the owner and founder of Lennox Skincare. And I am located in Oklahoma City and also located in Plano, Texas. And I was asked to do a couple of questions to help bring light or information to a couple of things that I specialize in. So, the first question was, why is multicultural skin important? Multicultural skin is very important because the U.S. within itself is a multi-diverse community, and the more and more that we move throughout the years, we have seen blended cultures that are addressing that when it comes to addressing skincare, you are finding more melanated rich skin where there's not been a lot of research and a lot of information on how to treat the skin, especially in our trade schools or some of our schools where we're teaching in skincare. And so what we're finding is that a lot of people that are dealing with issues as whether it's hyperpigmentation and acne, we are not able to address those issues with treatments as well as product or even knowledge. And so those people are actually turned away from being helped or service, and they are basically in a disadvantage. And so multicultural skin is very important, that we broaden the scope of practices when it comes to hair, when it comes to skin, and when it comes to the education around the anatomy for different ethnic groups. So that's why it's very important. The difference with multicultural is that we can treat all skin, from the most delicate to the most hypersensitive skin, or even the most cuprous skin. And so it's very important that we understand that, a person that comes in, depending on, we may assume, which we use the Fitzpatrick scale, that they are on one end or versus the other. It's very important to find out the primary parent, the grandparents, to be able to understand the ethnicity so we can know the risk and the precautions when treating the skin. And I'm speaking for skin because that's what I specialize in. So the next question is scalp care the new skincare? I think scalp care became I would not say it's the new skincare because it has not taken that seat. But I will say that after COVID, a lot of people have experienced thinning hair, alopecia, and then also even some of the more trending styles when it comes to hair has caused thinning hair. It has caused a lot of damage to the actual hair and scalp itself. We, as a clinic, tried to dive into that area, and it was just a little more outside of my scope of practice. However, we more so focus on cleaning the scalp and the education around cleaning, and actually doing a really good cleanse. So we kind of treat it like the skin. But far as scalp being the new skin, I think it's always been there. I just think that there's more education now around it, and there's more tools like laser, advanced technology as far as laser, AI lasers that I went to an aesthetics conference and it was there. To be able to treat, you can use microneedling, you're able to use injections, you're able to do so many other things, PRP, to be able to stimulate the hair growth, depending on what the cause is. I've also seen people that did go through alopecia that did it helped to stimulate hair. Myself, I have lupus, so I've gone through hair loss, and so I have experienced it myself, still searching for answers. So I would definitely leave that to a cosmetologist because they probably would be able to provide even more, or someone who is specializing in hair growth or alopecia, like a derm, or someone that specializes in that. The next question is, why is scalp care just as important as skincare? Well, I think at the end of the day, when we start thinking about skincare and scalp care, at the forefront is just hygiene. It's keeping it clean. We're exposed to so many elements that's in the air: mites, bugs, dust, and so many bacterials and fungals and products that we use, I think that it's just very important that we remain clean. And I believe that it's more of a hygiene situation than more so in comparison to skin. I do believe that it's just like with skin and hair, is all what you take in as far as food. When I'm treating skin, I am addressing lifestyle and diet as well, and even I'll say mental capacity, but more of the mental health of the client, because those stress factors affect the skin just as well as it affects the hair. So stress, if you're under a large amount of stress, you're going to see thinning, breaking, even spots like alopecia spots. Same thing with skin. You're going to see more of inflammation in the skin. You're going to see more triggers of pigmentation like melasma, because that's hormonal. And so those things really do tie together, not because of the external factor. It's more of the intrinsic factor when it comes to those responses, when it comes to like how the hair is going to grow and how the skin is going to behave. Because when I treat client, I always tell them this is the aftermath, but while we're working on the problem, we got to work on what the cause was, which goes back to lifestyle. The next question is what's some of the important skincare regime everyone should be doing. So one, you definitely want to make sure that if you're not doing anything else, you're definitely cleansing your face at night. You're out in the day, you're basically like getting all the dirt, the gunk of the day is on your skin, so it leaves your face like the dirtiest, like your hands. So cleansing properly, using an appropriate cleanser for your skin condition or type, depending on how you look at it. Also want to make sure that you're definitely hydrating and keeping it hydrated with a very water soluble moisturizer, and then also making sure during the day that you're protecting the skin with a sunscreen. So, but if you want to go more into corrective and correcting spots and acne and age management, then you're going to actually add more steps into your routine outside of the basics of basically a cleanser, a toner, a moisturizer, and an SPF. If you want to keep it basic, that's a good basic one to go with. But if you are wanting to dress more detailed and you want to really focus on like crow's feet, and you want to work on pigmentation, and you want to work on acne, that is where the other steps really become a part of your regimen. And it also becomes steps to correcting, because you're at home with your skin 80% of the time versus actually in with a professional. And so those steps are very important. But I am keyed on the most important is sunscreen and wearing it daily, not just on your face, but also on your neck, your décolleté, and then also making sure that you are protecting any skin that is that would absorb by the sun, because the sun can activate the immune system. And if you are taking any type of prescription meds, high blood pressure, any type of things that that are helping the kidney, actually I would say not even just that. If you are taking medication, make sure that it is if it is photosensitive, because if you're taking certain medications, that will cause and trigger your skin to burn, because your skin is changing based on the side effects from the medication. So that's another one. Hopefully this has helped, and my expertise has been very valuable in this case study, and I look forward to hearing and seeing the outcome of the case study that you guys are doing. Thank you, Dana, and all the instructors at Francis Tuttle. Thank you for always including me and thinking of me and reaching out to me as a subject matter expert when it comes to skincare. Thank you, and you guys have a wonderful and blessed day.